We'll talk about public policy and advocacy, and then I'm going to spend probably most of the time talking about what's happening in the state of Oregon. And then we'll talk about federal near the end too. So Dana, you're going to tell me when I have 10 minutes left, because I do want to make time for discussion. All right, so before we get into that, let's maybe set the tone and set the stage. When we look at workplace violence, how bad is it? Okay, so we're going to go through some statistics. All right, so we're taking a look at the Bureau of Labor Statistics, and the latest I can find is 2020 data. Some of the publications are 2018, but from what I could dig into their information, it's 2020. So incidents involving days away from work, and this is per 10,000 full-time workers, and that's your incidence rate. So for 2020, when we just look at violence in healthcare overall, let's compare it to all occupations first, right? In all occupations in the United States, it's 4.0. So you got 4 incidents involving days away from work per 10,000 full-time workers or full-time FTEs. For nursing assistants, orderlies, and psychiatric aides, it's 55. That's 13 3/4 times all other occupations. When we look at RNs, it's 18.2, which is 4.5 times. And then when we look into healthcare and social assistance, just in general, it's 15, which is 3.75 times. So that's just violence overall. Now, if we dig deeper into their data that talks about intentional violence or intentional injury to occupations, for all occupations, it's 2.1. Now, for nursing assistants, orderlies, and psychiatric aides, it's 41, which is 19.5 times. For RNs, it's 14.2, which is 6.7. And then for healthcare and social assistance, it's 10.3, which is 4.9 times. You'll hear often a repeated statistic of violence in healthcare is 4 or 5 or 6 times the rate of any other business that's out there, any other private business. You'll hear that often repeated, and that number fluctuates based off of the year. And including median days away from work, so we talk about a workplace violence event, how long for an RN, it tends to be 13, and it seems for everybody else, it seems to be 12. So if you think, what's 13? If we're working 3/12s, that's a few weeks. That's almost a month that somebody is off of work. So that does affect the bottom line. A graph here, and this is again from the Bureau of Labor Statistics, and you see an increase starting in 2018 all the way up to 2020. There's a slight increase for all workers on the bottom, but it's not nearly as big as the spike for healthcare workers. And again, when you look at the lower bar, the red bar, that's healthcare. So we have the market share on non-fatal workplace violence injuries and illnesses, and this is up to 2018. Another statistic is that healthcare workers accounted for 73% of all non-fatal workplace injuries and illnesses due to violence in 2018. So 3 out of 4 assaults that happen in healthcare. And this came from Press Ganey last year, and they were looking at their NDNQI data, and they came out with these 2 statistics. An average of 57 nurses are assaulted every day, and 2 nurses are attacked every hour. And we don't have to look far to look at violence in healthcare. Just Google it, nurse assaulted. So I have a few from kind of within the last year. So I'm gonna just give a brief overview of what these incidents were. So this first one from Providence, Rhode Island, a male was in critical condition after he was attacked by a long-term psychiatric patient who was told he couldn't use his phone at the hospital. The patient had been charged with a different attack at the medical center a year prior. So now that attacker is facing 2 felony counts. The next one, this happened in July of last year in Raleigh, North Carolina. A nurse was punched in the head, resulting in a concussion, a broken nose, and fractured orbit, which required reconstructive surgery. She suffers vision impairment, an inability to drive, and acute PTSD and has been, by the time they did this interview in December, she had been homebound for 5 months. And the patient was charged with multiple felonies. In December of last year in Milwaukee, Wisconsin, a patient who did not want to leave grabbed a nurse's hair from behind, punched her in the back of the head several times, and broke fingers, which that required surgical repair. It ended with her getting kicked in the jaw, and she had quarter and nickel-sized areas of hair missing. Even worse was the emotional toll, and the patient who assaulted her was required to undergo treatment program and was never charged. In February of last year in Massachusetts, a violent patient nearly strangled a nurse to death. And this is from February of this year in New York. A female patient slugged a 55-year-old male nurse suffering a laceration and double vision. The patient was charged with a felony, but it was reduced to a misdemeanor. And the quote from that stands out from this article is, "What good is the law if it doesn't have any teeth?" And in New York State, it is a felony to assault a healthcare worker. And then lastly, here at home, and this happened in July, a security officer was killed outside the maternity ward at a Legacy hospital, Good Sam. And, you know, I didn't have time to put it in here, but even just this week, 2 nurses have been killed. So one was in Connecticut. She was doing a home visit at a halfway house. Her visit was only supposed to be 8 minutes. And her phone was pinged an hour and a half later, still at the home. And another nurse in Tennessee was assaulted and died from her injuries at a behavioral health hospital. So it's happening. It's unfortunate, but we don't have to look far. It happens. So let's get into public policy. And so what is it? So definition. Here, it's a course of governmental action established to address the problems of society at large, rather than individual needs on a smaller scale. And in short, public policy refers to policies that the government makes on the public's behalf to resolve or address a specific issue. So what it is and what does it look like, it really is what the government chooses to do about something or even chooses not to do. And it's often through law or regulation, and that's the whole public policy aspect. Ultimately, public policy is made by governments. Even if the ideas come from outside the government, this is where advocacy comes in, or it's through interaction of the government and the public. It's a continuous process. You have to vet things out, so sometimes that takes a while. Sometimes it takes years to have the same discussion, and that's how it's been in Oregon. We've been having discussions on how to address workplace violence through the legislative process since 2015. And in that time, only one bill has passed, but it's not the same as what we're trying to do now. And what is advocacy? That's the act of pleading or arguing in favor of something, such as a cause or idea or a policy. It's giving active support to something. The act of pleading for, and these come from different definitions, but the act of pleading for, supporting, or recommending, it's active espousal of something, supporting a cause. So lobbying can be considered advocacy. So not all advocacy is lobbying, but all lobbying is advocacy. So I'm not a lobbyist. I'm not paid to do it. My work with the Oregon Emergency Nurses Association is all volunteer. So it's on top of my regular job. What it can also look like is educating legislators, educating the public on certain issues. It can involve research, training, as well as litigation can also influence and public policy and advocacy. So let's get into the Oregon specific, and this is where we're going to spend most of our time, because that is, politics is local, right? This is where we can affect change much easier than we can on the federal level. So just some basics about the Oregon state government. There's the Senate, which is called the higher chamber. That has 30 elected members, and they have a 4-year term. The House has 60 elected members, and they have 2-year terms. There's various committees, and a couple of here, they're in the House and the Senate. They're typically committees are on the both sides. They can have a joint committee that has both House members and Senate members, and they can have task forces. So like typically the ones I've involved with is the Committee on Healthcare or the judicial committees. The legislative sessions since 2010 is kind of unique in the nation. Our long sessions are 160 days. Days long. They start at the beginning of the year, about in February. And so those are on the odd years. So that was, this year was a long legislative session, start in January, ends in June. And for example, in 2021, 2,519 bills were introduced, but only 714 passed and became law. So that's 28.3%. So in that session, a senator or a representative can introduce as many as they want. They can introduce as many bills as they want. Now, in the next legislative session in 2024, it's the short session, and it's only 35 days long, and the legislators can only bring forward 2 bills. So a lot of work goes in the interim, the times between the legislative sessions, to develop something that they think, it's going to pass. That's what they want. And in 2022, there was 275 introduced and 127 passed. So that's 46. So you have actually more success passing bills in a short 35-day session. Some states out there are in session all the time, but Oregon has chosen to do longer and then shorter. So just general steps of how an idea becomes law. There's an idea to change or amend or create a new law, and it's presented to a legislative member. And that can be from a personal encounter with a legislator. It can be going forward as a group or a coalition. It could be the government affairs people at Legacy Health or even Providence or the Hospital Association. And that's really how it's spurred. Or if the legislator themselves knows about the problem, is intimately involved with it. So I'm going to name about 3 people. Representative Travis Nelson, he's from Portland. He is a nurse, and he's had experience in the emergency department. So he's been a strong champion of our violence prevention efforts. And then there's Representative Shelley Bossart Davis, and she's from Kaiser. And why she's involved is that her sister is an emergency nurse at Salem Health. So that's how they get kind of their drive to move violence prevention forward. So then the member decides to sponsor a bill, and they'll introduce it into their respective chamber, either the House or the Senate. They'll request the attorneys in legislative councils to draft a bill in the proper legal language. And that's great, because then that means I don't have to come up with the language. I can just give you the idea, and the legislative council comes up with it. And typically before the legislative session, they'll develop what's called a legislative concept, or an LC. They'll give it a number, and then when the session starts, it'll actually get a bill number. So it's then presented to the Secretary of the Senate or the Chief Clerk of the House, and they assign the bill a number, and they send it back to legislative councils to verify it's in the proper legal form and style. And then it's sent to the legislative chamber for the first reading, what they call the first reading. So that's either the Senate or the House. And then after the first reading, it's usually referred to some sort of committee. So typically bills start in committee. Sometimes they never move out of committee. They die in committee is what they say. But sometimes they move forward, and it might have to be referred to another committee in the same, like House or Senate. And so sometimes those steps can be a little arduous, a little nerve-wracking, because when the legislative session happens, it's very fast. It moves very fast. So, and then typically if it passes the committee, let's say it passes committee in the House, and then it will go to the House floor and get voted on and passed. And if it is passed and approved, it will go over to the next chamber, so go over to the Senate side, and typically it has to go through one of their committees before it goes to the Senate floor. And if it passes the Senate floor and it's already passed the House, then then the governor can sign the bill. But the governor also has the option to not sign the bill. If they don't sign the bill, it doesn't become law. So that's just a quick rundown. So let's talk about Oregon's history of violence prevention, and it goes really, from what I know, it goes back to 2007. House Bill 2022 is what developed our current Safety of Healthcare Employees law. And so they created that, but part of it was they wanted hospitals, all hospitals, to report workplace violence to the state for 1 year. And that's what they did in 2008. And then in 2009, they presented a report to the Oregon legislature. You can find it online. You have to dig a little bit for it, but it's House Bill 2022 for 2007. Because remember, every year bills get numbers and you have to know which year the number is in. Our first attempt at making it a felony to assault a hospital worker happened in 2015. That effort was actually spearheaded by Legacy Health. It was great to be part of the conversations early on. The struggle that has been over the years is it typically passes the Committee on Healthcare, but it doesn't pass judiciary committees. So that's often a struggle. Again, in 2017, we tried with House Bill 2622. 2019 was Senate Bill 823. Now, that did not have any felony legislation in the language at all. It was more of a hospital has to do an assessment. We have to report it to the state. They added some anti-retaliation language in there. So it was not as controversial, but that one passed pretty quickly. 2021, we tried again with House Bill 3161. And in 2022, we tried again with House Bill 4142. And last year in 2023, we tried with House Bill 2141 and Senate Bill 563. Now, some of the language was similar, and I'll go through what that looks like. But they were different bills. And if you want to scan the QR code, that'll take you right to those, and that's good. So through the years, when we talk about addressing a felony, making it a Class C felony to knowingly, intentionally, or recklessly cause physical injury to a person working in a hospital. So that's what we started with. And that is what we tried for a number of years. And that wasn't successful. So it morphed into taking out the word recklessly. So they have to intentionally or knowingly cause physical injury, okay? Now, physical injury, as what I've talked with district attorneys with, is pretty severe. Like, you need a broken bone, you need a bruise that we can see, you might have needed surgery, or maybe it's significant amount of pain. So for it to apply, there's a fairly high bar. And then last year, it went down to intentionally causes physical injury to a person working in a hospital. So I wanted to highlight some language in this Senate Bill 563 that made it very unique. So they had, it would be a Class C felony. However, the person may not be charged under this section if the person at the time of the alleged offense is seeking or receiving medical or mental health care at the hospital and is experiencing intellectual disability, developmental disability, delirium, dementia, traumatic brain injury, severe and persistent mental illness, or other condition that significantly impairs the person's judgment or behavior. That's a mouthful, and that currently doesn't exist anywhere in Oregon law. And you know, the discussions were great on this because we had the Oregon District Attorneys Association say, look, that part where it says, or other condition that significantly impairs a person's judgment or behavior, there's no place in Oregon law that covers that. So if somebody's drunk or somebody's high and they assault, then this wouldn't apply. And the Oregon District Attorneys Association, that doesn't, you know, you drive drunk, you crash, you kill somebody, you're going to be held accountable. So, you know, there was a lot of discussion around this. And I think last year what we quickly realized was these bills were introduced But then they were quickly pulled. They're like, we need more time to talk. We need more time to gather a group, a coalition, a team. We need both the proponents and the opponents to get together and talk it through. And so that's really what we've been doing since, we did that in February, and then we started back up in August, September, and October here. And so I'll give some updates of kind of where we're currently at, because it's changed even this week. So just a little brief from the 2007 law, just going over highlighting the Oregon Safety of Healthcare Employees law. And some highlights is that a healthcare facility has to conduct periodic security and safety assessments. They have to have an assault prevention and protection program. They have to provide training on a regular and ongoing basis, which has to include restraint, self-defense, documentation, post-incident counseling, follow-up resources for the employee. It has to be provided to employees within 90 days of hire, and the hospitals or health systems are supposed to review their program at least once every 2 years. And they are required to keep assault records for 5 years and make it available to a committee or a person that's doing quality improvement. Making it available came through that 2019 823 bill. Other highlights, an employee can request a buddy if the employer directs the employee to care for a patient who assaulted them. And if not, the employer may not require the employee to treat the patient. That's unique. And in home health, a home health employee may refuse to treat a patient unless accompanied by a second employee, or unless the employee is equipped with a communication device. So many different things of what you consider a communication device. Is a cell phone, can your cell phone act as a panic alarm? Or is there GPS-enabled things? So that's another topic. The employer may not sanction employees for using appropriate self-defense. And then when we talk about law, so that's really the highlights of that section of the law. One thing that we have to consider and think about, and maybe, me as an advocate for emergency nurses and the patients we care for, I don't really think about this, but it's like, we have to think of, further upstream. It's like, what can institutions agree to do on their own without having to put it into law? Because that can be kind of arduous, and, you want to be flexible because we have different size hospitals, right, that have different needs. So what you might want to apply for one might not work for the next, or you might not have the resources, you might not have the staffing to do that. So it's between this and this other part, what public policies should compel an institution or an individual to do something. And there's different ways of compelling, not only just putting it in law, but I was given the examples of you could do it where you require training to renew your license. Your own RN license, your own, practice license, or the hospital has to do this in order to renew their hospital license. So that's kind of the conundrum, the balancing act, is what can folks do on their own versus be compelled to do. So the coalition continues to work on violence prevention legislation. So some of these have changed. Not all of these bullet points are current, but we're still pursuing enhanced penalties for assaults on healthcare workers or hospital workers. It's actually changed. It would be a Class C felony, the latest version, if a person intentionally or knowingly assaulted a nurse, doctor, tech, or other hospital employee that they knew was a hospital employee. And they've put in some caveats of unless the assault was a manifestation of an illness. And so that seems to have more traction, that seems to sit better with people, and it's the proponents and the opponents seem to agree on that. There was an idea for a public ad campaign. I think one of the states on the East Coast passed that in their legislative sessions recently. They have to form a committee, and the committee has to come up with research and, figure out what they want to tell the public and how. So another thing that's been happening and popping up is covering post-traumatic stress in workers' comp, because typically that's not covered currently. It's typically only physical injuries that are covered. So more states, and I have some in the next slide, some examples of what states are doing. Another topic that has been brought forward probably for next year has been signage, requiring hospitals to post signage of, especially if this enhanced penalty felony law passes, it's like you need to post signage that says, hey, it's a felony to assault a healthcare worker. And on the flip side, they're also recommending that signage is posted for staff so that they know their rights and they know how to report, really, how to report to law enforcement, and they can't be sanctioned for that. They can't, anti-retaliation laws. Another topic is performing a root cause analysis for assaults that result in hospitalization. So really digging into those severe ones, the severe events. Anti-retaliation for reporting is technically already in the law. Reporting workplace violence prevention outcomes to the state, now that's morphed into, what does that look like? What are outcomes? We haven't agreed on what the outcomes are. There's suggestion that you look at not only the number of violent events that would decrease, but also the severity. So you're looking at workers' comp payouts. And one researcher suggested to me, she's like, we should probably measure the secondary traumatic stress levels of our staff before you do something and after. Because one of the recent studies showed that a significant number of emergency nurses suffer from secondary post-traumatic stress. Another idea that has been kind of quashed, I think, is sharing the assault-related video with the victim. That introduces all sorts of conundrums like, how long do you save it? What about HIPAA? Things of that nature. So that one would need to be ferreted out. But hey, if I was assaulted significantly and it was caught on video, I'd want to see it. And really, it is evidence of a crime. The other thing they've put forward is training at least every 2 years with anyone who interacts with patients or members of the public. So that might expand, if that language would go into law, it would expand our training that we would have to do. And if everybody has to do it every 2 years, that's a significant lift. They also floated metal detectors and or screeners at public entrances. Now, that's, logistical. I mean, there's many of you in this room know the logistical nightmare of that statement. Just because, metal detectors, the science behind them doesn't show that they actually decrease workplace violence incidents. Yes, you are going to find more weapons, right? If you're going to look for them, you're going to find them. But they haven't been shown to actually decrease the number of workplace violence events. What did we hear last year is that the metal detector themselves aren't expensive. It's staffing them that's expensive. And sometimes you can't find staff 24/7. Another thing that's been floated is badges containing only first names. They've actually added in that to give the employee the option, if they wanted to add their last name, they could. But that's been a topic of concern for somebody stalking a caregiver by knowing their first and last name and being able to look it up on the internet. And they also suggested that bedside workers participate in the remodeling or building planning committees. So that's looking at, you think about the caregivers who give the care in the department, in those rooms. What should that design look like? It's like, if you're going to put the computer over here, which is opposite the door, I have to go around the patient to get to the exit. So things like that. It's like, well, maybe the sink shouldn't go here. Maybe it should go over here. So, and sometimes we hear of places that have been redesigned. It's like, well, who thought that up? And it's like, well, did you have a bedside caregiver, in your committee that could have given you feedback? The bedside caregiver is the expert. So here's what some other states are doing in the last couple years. Arkansas, they have to post a notice of a felony statute in the hospital, so that's signage. In Florida, they expanded the felony protection to all hospital workers, not just nurses and physicians. In Kentucky, it requires development of a workplace safety assessment. In New Jersey, it's a crime to threaten healthcare workers, and it adds anger management and community service penalties. And Wisconsin, a couple years ago, also made it a felony to threaten a healthcare worker. In Texas, they just passed that all hospitals have to have a violence prevention plan. In Washington State, they added workers' compensation to cover PTSD for direct care nurses. It existed already, they just had to add direct care nurses to the law. And in Oregon last year, or this year I should say, we established minimum nurse to patient ratios, which there is science that shows that the caregiver's workload does influence workplace violence. There's an older study from that was kind of spearheaded by the ENA. That one of the titles in that study is "Nobody Listens, Nobody Cares," and what they show is nurses are so task-oriented, they're so task-focused, I need to get this done, I need to get this done, that the patient that's right in front of them, they're missing cues that they're escalating or they're becoming agitated. So just our care environment, itself can contribute to workplace violence. All right, so that's the state of Oregon. Now I'm going to jump into the federal government. It's going to be shorter, but really I want to highlight that if you want to affect change, start locally, start in your state. Okay, it's not to say that you can't affect, legislation on the federal level. You can, but really where you are, where you live, where your home is, that's ideally where most of the work is done. So some basics about the federal government. The House of Representatives has 435 members. Oregon now has 6 representatives after the 2020 census. We used to have 5, now we have 6. And my representative is in the new district. In the Senate, they have 100 members, 2 from each state. Sessions of Congress are every 2 years, and we're currently in the 118th Congress. So that started earlier this year. So we're coming up on the first half of the legislative session. So bills that are introduced in this session, if they don't pass this year or next year, you have to start all over. You have to start from scratch. There's no carryover. And that's the same in Oregon law. We don't carry bills over from legislative session. You might just reintroduce the same thing. So there's 2 active proposals on the federal level for addressing workplace violence. And this first one is Workplace Violence for Healthcare and Social Service Workers Act. It is currently Senate Bill 1176. It's also House Bill, or on the federal level, they use HR 2663. So it was introduced, it's typically introduced in the House first. This is actually the 3rd legislative session that we've introduced these bills. They've passed the House 2 previous times, but they get stuck in the Senate. So what does that do is it's kind of similar to how we already have it for Oregon, right? We already have to have a violence prevention program. We need to do training. And this would do it on a federal level, and it would be OSHA that would have to enforce it. They would have to develop the rule, and they would have to enforce it. So they must issue an interim occupational safety and health standard that requires certain employers to take actions to protect workers and other personnel from workplace violence. It applies to employers in the healthcare sector, in the social service sector, and in other sectors that conduct activities similar to healthcare. So you're looking at nursing homes, group homes, things of that nature. They also say that the program should be based on OSHA's guideline for preventing workplace violence, which that's been out since about 2015, 2016. And OSHA would have to develop a interim standard within 2 years of the law passing, and then a final standard within 42 months, so not quite 4 years after the bill passes. And so the second one that is on the federal side is what's commonly known as the SAVE Act, which is the Safety from Violence for Healthcare Employees Act. And that is, on the House side, it's 2584, and on the Senate side, it's 2768. And what that would do is establish a new criminal offense for knowingly assaulting or intimidating a hospital personnel during the performance of their official work duties in a manner that interferes with their performance of their duties or limits their ability to perform duties. So that's a broad. So here's where the conundrum is. All right, so the federal government is going to make it, it's against the law, the federal law, to assault, a hospital worker. How does that work? Who enforces that? What federal agency is going to interface with your local law enforcement? We kind of don't know. But where we can draw it from is the laws that exist that protect flight attendants. Because you think about it, they're flying over different states. Okay, and I'll get into a little bit more specific on that. It also authorizes grants to reduce the incidence of violence at hospitals, including violence or intimidation, while they're performing their duties. And the penalty is pretty stiff. The penalty is a fine or up to 10 years imprisonment, or if it happens in a declared public emergency, or if it happens with a deadly or dangerous weapon, that doubles it. 20 years. That's pretty significant. So we talked about this is kind of modeled after protecting flight attendants. So the reason why this act was introduced is these following reasons. So they consider an assault and intimidation against a hospital employee to affect interstate commerce, right? And this is why. Hospitals are heavily regulated by the federal government, all right? Hospital revenue comes from interstate or federal sources. So you've got out-of-state insurers, you've got Medicare or Medicaid, and the hospital employees who are victims of assault or intimidation are prevented from purchasing goods and services, obtaining or sustaining employment, or participating in other commercial activity. So that's kind of the angle where that federal, to make it almost a federal felony to assault a healthcare worker comes from. So those are the two that are actively going forward in the federal government. So really, to cap it all off, what's the importance of, advocacy and public policy? It really enables people to be heard. I did a presentation a couple weeks ago, and I said the public won't know unless you tell them. The public doesn't know how bad it is. The public really doesn't know what we face day to day. So we need to tell them, okay? We need to tell them our personal story. Advocacy influences laws and policies, of course. It enables people to better understand each other. So when you get proponents and opponents in the same room, you're not in the echo chamber, you can bounce things off, and you probably come up with a better product than if everybody just agrees. And it promotes problem solving and participation. It highlights available resources like, well, that might work, but we don't have the resources for it. And, they're very hesitant if it's going to add a fiscal, you need revenue for this, it's going to cause we need millions of dollars for this. That kind of, makes people on edge because you don't want to have to add to the budget and things of that nature. And it educates the greater community. And we can consider it a fundamental component of nursing's social mandate. So we need advocating for the patients that we take care of. Public policy, it forms guidelines and principles of society. It's still an effective way to have your voice heard. I found this one interesting. It can outlast governments and politicians. Yeah, so if it's put on law, it's gonna stay there until somebody takes it away. It can produce measurable and positive result for the general public too. So what can you do? What can you and I do to help move some of these things forward, or even something that we're passionate about? It doesn't have to be workplace violence or violence prevention. So really, this QR code will help you, take you to a site that can help you find your local legislator. It'll help you find your state rep, your state senator, your secretary of state. It'll help you find your federal representative and senator as well. And it'll give you who the president is and the vice president too, which is the same for everybody. I would also encourage you, if you find out, go to their website, because there's lots of information. They usually also typically put on there what their priorities are. And you can send them a message and they can get back to you. Now, even on the federal side, when I send letters to, federal legislators, like I sent one in February or April, and I heard back from them in August. So, it's slow like molasses. You can sign up for newsletters. You can sign up for town halls. Town halls are easy now, with COVID. My former representative, Suzanne Bonamici, they'll call you. Like the day before, they're like, hey, we're having a town hall tomorrow at 6. We will call you. And it's up to me whether to accept or decline the call. But, you can press like 6 to ask a question. You don't ask it live. It usually goes through a screener. But that's another way of participating. If you belong to a professional organization, like I belong to the ENA, ENA's government affairs is fairly new, probably within the last 5-7 years, that we actually have lobbyists in Washington, D.C. that work on the behalf of ENA. And they also help support all their states, all the states that have an ENA chapter or a state council. They also help them with their government affairs things. So they're kind of doing double duty. They're doing federal and they're doing state. You can also work with your hospital or health system's government relations. They're a great resource of what's happening. And you can even visit your legislator in person. You don't have to go to Washington, D.C. to see them, especially your federal representative or senator. You can do it in home. You can do it here when they're in their legislative district. And the same with the state. So that's pretty much it. I think we do have time for questions or comments.